Thank you for tuning in. So today we're going to provide some more updates that was given to us by the Texas Health and Human Services Commission that came out recently. And so we just want to reach out to you today with our continued education, just reporting some of the things that are being reported to us. So we're making sure that our staff are aware of what's going on, and so that we can take whatever precautionary measures and protective measures to ensure that our clients and our staff are being safe in the delivery of care during this time. So first and foremost, we are considered essential services, meaning that we are the ones that are going into clients' homes to provide an essential need. Over the coming days, there may be some policy changes on assisted living, nursing homes, or some care facilities that we will coordinate and work with to ensure that we're in compliance with everything that they're requesting or requiring of any visitors coming in to provide services or to see any of their residents. But just know that we are considered essential services under Texas Health and Human Services Commission. One of the things that is going to be key is identification. So making sure that you're wearing your name badge and or your shirt to show to any of these care facilities and or going to a client's home what our normal policies and procedures are for being able to identify that you are with our agency. Okay. Now, one of the things that is new is the daily screenings, and we are working on a process of how we're going to track these. But you're going to have to screen yourself individually daily in order to be eligible to go see clients in their home. Okay, so one of the parameters for temperature is if your temperature is 104 degrees or above, you are not going to be allowed to go see your clients, and you're going to have to notify the office of that temperature so we can monitor and track any progress. Additionally, if you have any symptoms, fever, cough, shortness of breath, or a sore throat, we're going to be documenting and tracking that on a daily basis as well, and so you're going to need to report those symptoms to us. If you've had contact with a positive COVID-19 known case within the last 14 days, so that means direct contact with that individual in the last 14 days, you must report that to us immediately so we can give you some additional information and guidance on what the next steps are for you. Travel to known locations of community spread COVID-19. So the CDC has published some of the areas that are known community spread. And if you are traveling to any of those locations, you have to notify us so we can advise you on what the next steps are. Recently, we published and notified all of you that if you are traveling outside of our area, that you're to notify us. It is simply to stay in accordance with the CDC guidelines, help keep you safe, and monitor any symptoms that you may start encountering now returning home. Preventative measures. Make sure that we're continuing to ensure our preventative measures. Make sure that we're limiting physical contact with our clients and or family members or just anybody in general. So handshakes, hugs, we really need to limit or get rid of those during this time until we can get over the period. I know we want to have that interaction. Just understand that this is some of the preventative measures to help stop the spread and hopefully get us over the hump. Reinforce strong hygiene. So hand washing, sanitize your hands with the hand sanitizer. Make sure that we are doing this frequently throughout the day. If we are touching any high contact places, make sure that we wash our hands after, prevent touching your face as much as possible, and just continue those good hand washing and hygiene principles. Social distancing. So that's something that's been a common theme, and pretty much anybody that you listen to talking about this spread of this virus or stopping the spread of this virus is social distancing. So staying 6 feet away from any individual, trying not to come in close contact, such as the hugs, handshake, and that sort of stuff. So when we're in our client's home or even coming into the office, make sure that we're practicing that social distancing. Now, there are some essential services that we have to provide, such as bathing or actual hands-on assist for transfer or ambulation, that we need to make sure that we're protecting ourselves. So if we are having any direct contact with our client, as we've always taught, we need to make sure that we're using gloves. Wash your hands before you put the gloves on. Put the gloves on. After you're done, roll the gloves up, dispense of them, then wash your hands again. Okay, make sure that we're disinfecting any high touch areas, walkers, canes, bathrooms, tubs, sinks, anything that we're constantly touching, doorknobs. So make sure that we're disinfecting that while we're in our client's home. Client education. So continue to educate your clients about what preventative measures we are taking. Make sure that they understand that we are essential personnel coming into their home, but also understand that they do have the right to refuse visitors. Okay, not necessarily essential personnel, they can do that, but we're not requesting that they refuse our services. But if they have visitors such as friends, family members, little kids, we want to encourage them to limit that interaction just for their health and protection. Okay, so refusing visitors, they do have the right to do that. Let's just make sure that we reinforce to them to limit their interaction with the outside world right now, so we can protect them. Preventative measures, make sure you discuss with all of our clients the preventative measures that we are taking to help reinforce good health, hygiene for their protection. If they have any questions about our preventative measures, have them give us a call at the office. We'll be happy to provide that information to them. Documentation. So as I mentioned, we're going to be doing the daily screenings and documenting. We will be publishing some information to you, sending that out through our system so you understand what the new requirement is. Some of this is going to require a thermometer, so we're going to educate our staff on how we can get these tools out to your disposal so you can check that, and then some new reporting. But if you have any questions, have any confusion about any of our policies or what's coming down from the state or federal government, please give us a call at the office, and we're happy to help answer any questions for you, your client, or any loved ones you may have. Thank you.